What do you think are the essential qualities of caregivers?
Humility,
commitment,
a great listener,
passion,
strong clinical expertise,
effective communicator,
empathic,
and seeking excellence.
When we think about caregivers, we really think about the entire organization.
Caregivers are all of us.
Nurses, housekeepers, transporters,
EVS staff are people answering the phone.
or an aide, or someone in our ambulatory facilities.
all of those interactions are really important to the patient experience.
There are many folks at all levels of ability and education and background who want to make a difference in the world, who want to use their life to make the life better for others. That's the essential ingredient of a healthcare worker.
But if you peel the onion and you dig into these great clinicians that we have in our organizations, and you really understand what drives them, it's this humble sense that I could always be better tomorrow than I am today.
Today's healthcare deliverer needs a lot more skills than they ever did. That person has to know how to interact with technology, how to gather information, and as importantly, communicate it to the patient and their family in an effective manner.
You know, exceptional care happens in so many ways. There are so many vignettes.
Many of the situations aren't just about the person that we're treating, but it's the entire family.
We have a 6-year-old girl who's going to go in for surgery, and her dad's away overseas in the military. And when the little girl wakes up in post-op, one of our nurses is dressed as Elsa from Frozen and says, "Hey, your dad sent me to make sure you were okay." And then they video chat live with the dad. Not only does surgery have to go right, not only do we have to get the bill right, not only do we have to make sure that there's no infection, we got to deliver Elsa to every little girl that comes into our doors.
We had a patient who was terminally ill with cancer in our ICU, and his dream was to watch his high school daughter graduate from high school. He unfortunately didn't think he would make it. And so we worked with the school and the team to bring that school so his daughter graduated in the hospital with him so that he could experience that, and then he passed peacefully. And the common theme through all of these things is this common humanity and creating these micro moments of positive resonance for our patients.
Treating the person not as a room number, but as a human being at one of the most vulnerable times in their life.
All caregivers need to have their primary focus on what can I do and what can the system do to advance the needs of that individual patient.
and that means lifting up people's roles and also freeing them to bring themselves to their job. Because that's when they connect with our patients, that's when our patients feel cared for, that's when they feel surrounded by people and they can be confident that they're getting good care.
I've had children on their own healthcare journey in my life, and I've watched caregivers bring my family through the most trying of circumstances. And for that, I am deeply and forever grateful.
And I appreciate what you do and how you represent our organization. Thanks for what you do for us, and thanks for what you do for our patients and our members. You're the future of our profession. The country needs you. You will have a very fulfilling life. I'm deeply grateful to all of you.
What a gift that you have as care workers, that every day you have the opportunity and you change people's lives.
Every touch, every word, every encounter makes a difference. And I want to thank every caregiver out there for what they're doing every day to support improving the care experience and providing the best possible outcome for the people that we serve.